How does eyeball shape affect myopia and vision focus? Imagine your eye as a tiny camera. The way this camera is shaped determines how well it can focus light and produce a clear image. In myopia or nearsightedness, the main issue is how the shape of the eyeball influences this focusing process. When your eye is perfectly shaped, it's roughly spherical, allowing light to focus directly on the retina, the light-sensitive layer at the back of your. But in myopia, the eye is usually longer from front to back, a condition known as axial elongation. This elongation causes incoming light to focus in front of the retina instead of directly on it. As a result, distant objects appear blurry because the image is not sharply focused. This elongation isn't just a simple stretching. Research shows that the shape of the back part of the eye, called the posterior segment, also changes. The curvature of the retina and the layer beneath it, known as the retinal pigment epithelium, can become more curved or protrude slightly. These shape changes are important because they influence how light is bent and focused inside the. When the curvature increases, especially at the back of the eye, it can make myopia worse and even lead to more serious eye problems over time. Sometimes, the elongation of the eye isn't symmetrical. It might stretch more in one direction than another, causing the shape to become slightly oval rather than perfectly round. This uneven growth can affect how light is focused and may influence the severity or type of myopia a person develops. For example, if the horizontal part of the eye elongates more, it can cause specific distortions in vision. The shape of the eyeball also plays a role in the risk of developing complications. In cases of severe or pathological myopia, the shape distortion can lead to issues like retinal detachment or macular degeneration. These are serious conditions that can threaten vision if not monitored and managed properly. That's why understanding how the shape of your eye changes is so important for eye health. In summary, the elongation of the eyeball causes light to focus in front of the retina, leading to nearsightedness. Changes in the shape, especially at the back of the eye, influence how well your can focus and can increase the risk of complications. Asymmetrical growth and shape distortions are also factors that affect the severity of myopia. Regular exams are essential to monitor these structural changes and help manage myopia effectively. Remember, every eye is unique, so personalized care from a health professional is always the best approach to protect your vision.